Afternoon, everyone. My name is Sophie Phillips, and I am the CEO of TexProtects, Prevent Child Abuse Texas. Thank you for joining us this afternoon for episode 2 of our Zoom Lunch and Learn series. It is a provider toolkit, how we look, learn, and listen to protect children and support families during COVID-19. And so for those of you who may not be familiar with TexProtects, our mission is to protect Texas children from the trauma of abuse and neglect, and empower families to thrive through education, research, and advocacy. And we have been partnering with fabulous other organizations across Texas and nationally to bring you this series. And so today we have 2 phenomenal speakers with us. We have Dr. Bart Klika, who is the Chief Research and Strategy Officer with Prevent Child Abuse America, and that is the chapter to which TexProtects is the affiliate here in Texas. And then we have Toni Sutton, who is the Child Protective Services Investigation Regional Director for Region 3, which is the North Texas area. And so we have both of those individuals with us today to share a little bit how we can protect kids by empowering our families during this really challenging time, and continues to be a challenging time, as well as the signs that we can look for and appropriately support families who we may be concerned that there is something happening in the family, but we're not always sure where to go or how to navigate the child welfare system. And so this is just a really vulnerable time for our parents and for our kids and for service providers and all of us. And so we're grateful that we have phenomenal speakers with us here this afternoon. And so just a little technicality, if you have questions throughout the presentation today, please type them into the chat box. You can send them to everyone if you would like others to see your question, but you can also send them anonymously by selecting Send to Jennifer Lucy in the chat box. And we will take time after the 2 presenters, well, 3 presenters. We also have Jennifer Lucy, our Director of Public Policy, who will speak today as well. And so we'll address those questions at the end today. We had a poll, but it's gone awry today, and so Jennifer is going to ask a few poll questions that we just ask that you type into the chat box so that we can see who is with us today. And so with that, I am going to pass it over to Jennifer Lucy.
Thank you, Sophie. My name is Jennifer Lucy. I'm the Director of Public Policy for TexProtects, and thank you all for joining us today. So as we begin, I do want to share a little bit about the rationale for this webinar and a few numbers that might serve as a background for our conversation today. But as Sophie mentioned, I want to start by learning a little bit more about who you are. And so we're going to do this a little bit old school, if anything on Zoom can be considered old school, I don't know. But if you could do us a favor and just put your answers in the chat box, I'm gonna go through 3 questions one at a time. And we'd love to know kind of who you are and who's out there, since we can't be in the same place with you today. So I'm gonna start with this one. This should be easy. And the question is my primary interest in attending this webinar today is professional or personal? So you can just answer in the chat box with professional or personal, and I'll give you just a moment to do so. Thank you all. Okay. And the second question is, what would you say your sector of work is? And so I'll give you some examples, but you can answer as you feel comfortable. Maybe you're from the healthcare sector or the education sector. Maybe you're state agency staff. Maybe you're mental health. Maybe you work for a nonprofit or even a for-profit organization. Maybe you're an advocacy organization, early education and care. So the second question is your sector of work. This is so fun. Perfect, okay. It's exciting to see everybody that's with us today. Thank you so much. Okay, and the last question for the sake of time is the area of Texas. And so maybe we'll just think kind of in big regions. So are you from North Texas and the Panhandle, East Texas, West Texas, Central Texas, or South Texas? Or another state, perhaps? All right. Thank you all so much for helping us with that. And it was, I think, good grounding for all of us to see who's on the line and where you are in the world and the kind of work that you do. And I feel really excited about getting to share this conversation with you today. So with that, let's get into our conversation. As many of you know, research tells us that child abuse and neglect can increase during times of disaster and emergency. And certainly the COVID-19 pandemic is one of those. So this has resulted in social isolation, increased stress, and limited access to services. These challenges have made it hard for parents to care for their children. If any of you on the line are parents, we can all raise our hand and agree that this has been an unprecedented challenge for us as moms and dads and caregivers. It's also been hard as providers to figure out how to support families and help ensure child safety when many of our normal avenues have gone away. We're really having to be innovative and flexible. And it's also been harder than usual for communities to recognize and report abuse. And so with schools and community services closing their doors, our interactions have shifted to virtual interactions, much like the ones we're having here today. And that has really spurred some exciting innovations, but also some real challenges in our work. To be sure we're still able to offer families what they need and maybe their time of greatest need, and ensure child safety. So a couple of notes as we begin, and Beth, if you want to kind of move into the slides that have some numbers on them. There we are. There's the agenda. So with 1 in 10 American children living in Texas, we know that what we do here matters, not just in our communities, but really nationally. And unfortunately, as many of you may have seen last week, the Annie E. Casey Kids Count report continues to find Texas in the bottom third of the country in terms of how policy is ensuring child well-being. Also relevant to our discussion today, Beth, if you want to go to the next slide, you'll see here some 2019 statewide numbers for child welfare. And the takeaway I really wanted to highlight here, because I think it's relevant to parts of our discussion, is that you'll notice that the vast majority of calls to statewide intake don't result in referral. In removal. Rather, most are either ruled out or families are referred to other services. And so I think that's important as we think about sort of the process and what it means to make a call to report abuse and neglect. And finally, on the last slide, I wanted to point out a couple of things here again, because I think it's a little bit grounding for our conversation today. You'll see that the majority of confirmed cases are for neglect rather than abuse. You'll also see that most confirmed victims are under age 5. And so all of this really points to our need to create collaborative, holistic, family-centered approaches to ensuring child safety. Because in many cases, families don't need protection, they need help. And keeping kids safe in many, if not all cases, means working to support their families. So with that, I'm gonna hand it off to Bart from Prevent Child Abuse America, who's going to share with us some ways that we can do that.
All right. If we can get the technology working right away, I think we'll be good. All right, I'm going to assume that everyone can see my screen here. So thank you for having me today. I'm Bart Klika. I'm the Chief Research and Strategy Officer for the National Office of Prevent Child Abuse America. We're located in Chicago, Illinois, and I've been located in my guest bedroom for the past 4 months. Just briefly about our organization, Prevent Child Abuse America operates chapters of our organization across the United States in nearly all 50 states. We also operate the evidence-based home visiting program, Healthy Families America. We have nearly 600 sites across the country serving approximately 70,000 families a year. And we also do a fair amount of work in Washington, D.C. with our policy team, looking at policies and legislation that have to do with the prevention of child abuse and neglect. And when I say prevention, we're really focused on doing those things for families, to support families, to stop them from entering the child welfare system. Now, as the opening comments were going, of course, I'm scribbling notes and sort of upset with myself that I didn't add a few other slides. You know, I think to kind of preface some of my comments here, one of my takeaway messages is that, you know, in order to prevent child abuse, to support children, to support families, we got to support parents and caregivers in their roles as caregivers. And, you know, we find ourselves at a time where, you know, we have a child welfare system. We hear all sorts of things about the failings of the child welfare system. And what ends up happening is we continue to pile things onto the child welfare system to say, well, now it's your responsibility for this and it's your responsibility for this. But what we're lacking in this country largely is a true prevention system, a coordinated, sustained prevention system that allows us to protect and to support families before the need for any sort of child protection or child welfare involvement. What we really envision, and a good colleague of mine, Jennifer Jones from the Alliance, and I we're just working on a piece where we are talking about the need for a true prevention system in this country, whereby we would look for opportunities. The idea is that all families need support across the developmental continuum. Not every family requires a manualized treatment program or an entire span of a program like Healthy Families America. Some families just need light touch interventions, and they might need interventions at different points in their development. And so we find ourselves not only right now, but in the context of COVID and everything else going on, sort of scratching our heads and saying, you know, how is it that we build this coordinated, sustained prevention system so we can support families, as Jennifer was saying, with issues around like concrete supports and things that I'm going to talk about here in just a minute. So that's to preface some of my comments. But the graphic that you see on the screen is one that's been circulated around for the last couple of years. And this really gets at conversations around addressing the social and structural determinants of health and inequality. Now, everybody on this call has likely heard of the Adverse Childhood Experiences study and all of the research that has come out of this line of thinking. And that's to suggest that when we look at the accumulation of negative experiences that happen in people's lives, it's no surprise that that can then lead to negative outcomes later on in life. And what this graphic says is that, you know, if we think of adverse childhood experiences, kind of those 10 ACEs that we often talk about as leaves of the tree, as a profession, we've been spending a lot of our efforts in thinking, how do we take care of those individual branches or those individual leaves? How do we take care of, you know, child abuse and neglect, mental health problems, domestic violence, homelessness, all of those things? But what this also suggests is that if we truly want to address these problems and these issues, that we really need to look below the surface at some of the root causes. And so when we think about some of the root causes of adverse childhood experiences, we look at things like poverty, discrimination, lack of opportunity, racism, poor housing quality and affordability. These are all some of the preconditions, some of the social and structural determinants that eventually lead to ACEs. So this was a graphic that was circulated prior to COVID. And then we had COVID hit. And with COVID, I know in a lot of our discussions, we've kind of the picture on the left, is kind of a representation of, we're at a time where there's not necessarily a playbook for us as a field about what to do, how to do things, because we find ourselves in uncharted territory, both as it relates to COVID and to shelter in place orders and the complete shifting of many of our practice systems and our practice models to virtual platforms, and the many challenges that brings for us as service delivery folks, let alone the service receipt aspects of what many of our families are having to go through. You top that off with all these acts of racism that have been going on in our country right now, and we find ourselves, as Jennifer had said, in very unprecedented times. There was a reverend in North Carolina that talked about this notion that, currently it feels like we're all going through a very treacherous storm, but it's important to keep in mind that not all of us are weathering this storm in the same types of vessels. Many of us have experienced the effects of COVID in different ways. Some of us have been more exposed than others, whether you're working on the front lines, whether you have pre-existing conditions. And then when we talk about these social and structural determinants of health, we start looking at why it is that in some of our data, we're seeing that, especially in communities of color, we're seeing substantially disproportionate rates of deaths as it relates to COVID. So all this is to say COVID has really surfaced many racial and economic inequalities and has forced us to have many conversations as a field about charting the course forward. And so as we take that graphic that I started with, let's see, maybe we have it here. I've got one more slide before I get there. I'm going to talk a little bit about how that graphic has shifted a little bit in the context of COVID, but to maybe start out by saying early on in the pandemic, some researchers, Dr. Shauna Lee from the University of Michigan, she operates the Parenting in Context Research Lab, did some work to survey parents. This was done at the end of March, so you can understand this was, I believe, within a week of many of the presidential shelter-in-place orders that came down, to understand something about what are families up against right now? How are they experiencing these shelter-in-place? How have their lives changed? And these surveys highlighted a number of different things. First of all, many of the financial concerns that families were experiencing. A large percentage, over half of families, were saying that they had experienced some form of financial concern as a result of COVID, as well as the issue of social isolation. What COVID has done, in essence, has really isolated families. And we've heard a lot of concerns about kids and families having to shelter in unsafe circumstances. And we definitely share the concern that many kids and many families have been having to shelter in unsafe circumstances. But these surveys also asked families about things like, what are the concrete challenges that you've experienced, like job loss and financial insecurity, as well as their own experiences of things like anxiety symptoms and mental health issues that have been brought on as a result of COVID. And what this really finds, even early on in COVID, is that families were struggling. And, as kids were having to transition to doing remote learning or virtual classrooms, parents are trying to manage technology, whether they're just basically trying to get access to the technologies, or they're having to both balance working while supporting their children. We saw rates of stress increase for families. We also saw through these surveys that there was a fair amount of relational strain that families were reporting, that some of their supportive relationships had been strained as a result of the pressures they were under. Currently, Prevent Child Abuse America is doing some work with the American Academy of Pediatrics, as well as Tufts Medical Center, to do a new round of parenting surveys, whereby we're going to survey caregivers across the country. We're doing 3 separate surveys where we ask about parenting and caregiving in the context of COVID, to understand what are the challenges that caregivers are up against, understand something about child discipline in the context of COVID, understand how families have been affected by financial, economic strain, things like job loss, as well as their experiences of racism and how that has affected families. So some of that work is underway. And so this really brings us to thinking about kind of a modified version of that initial graphic that I had shared, and that is there are many experiences, adverse experiences associated with COVID, and many of those things have to do with things like food insecurity, lack of access to paid family leave, or the ability to work remotely in some jobs. Risk factors that, health risk factors that place people at higher or disproportionate risk of having severe complications as a result of COVID. And then I had mentioned, the issue of technology. I mean, as an organization, we had to shift nearly overnight to remote service delivery for our Healthy Families America home visiting program. That means that not only did we have to try to provide guidance to a professional workforce, but helping them understand and recognize the needs of families. How was it that we were going to get the technology, the actual concrete technology, phones, tablets, computers to families, get them access to internet? But, before I came to Prevent Child Abuse America, I was working in remote communities in Montana. And we know that there's many families that don't necessarily have access in some of these remote communities. And so all this is to say that when we think about addressing even some of these COVID-specific experiences of adversities, again, it takes us below the surface in saying, if we truly want to make a dent in some of this stuff, we really need to be thinking about addressing some of the structural and social determinants of health and inequality, looking at poverty, discrimination, racism, lack of opportunity. So a few resources that I did just want to share. One of the biggest questions that I get whenever I do webinars or talk on this topic is, Bart, we're really concerned about families sheltering in unsafe places. What do we do if we're concerned about children and families? And as I said, that, we share that concern. I don't know if folks saw the Washington Post article that came out yesterday, but that was talking about, we have to balance our concern for families with the idea that many families and many communities have experienced a significant amount of resilience and have shown an incredible amount of resilience during this time of COVID in finding new ways to connect and finding new ways to adapt. And so, I think we have to balance our narrative of being concerned for families, because we definitely are, with the idea that many families are doing great things with their kids and families, and we want to be able to build upon that. So a few resources for professionals out there. Futures Without Violence put out a great resource that I have here up on the screen, which really talks about what to do if you're concerned. What are some of the things that we can be doing to support families during this time? And I think that, one of the common themes that we've been hearing is making sure families have their basic needs met. Food, water, shelter, safety, diapers, making sure that families first and foremost have access to those concrete resources. If we have an opportunity, maintain consistent communication with families. If you can do things virtually, great. If you can do things at a distance and do them safely with social distancing, great. And then not forgetting that right now we need to make sure as a professional workforce that we're doing what we can to take care of ourselves. The notion of putting your oxygen mask on first. For many of us, we've experienced not only the secondary trauma of of hearing about COVID, working with clients who are experiencing COVID, but many of us have experienced primary trauma in our own lives with people that we know have experienced COVID, losses we've experienced as a result of COVID. So this is, I found, a great resource for professionals that really helps us think about ways in which we can support families. Another one came out of the Zero Abuse Project, and this is really guidance given to multidisciplinary teams. Again, there's 25 tips that they have. Many of them are the things that we've sort of talked about, making sure that you're reaching out to families, having consistent contact, developing emergency plans for those kids and families who otherwise might be difficult to reach with typical technology platforms. This came out of New Hampshire, the department out of New Hampshire. What I liked about this is it was sort of providing guidance to professionals about how is it that if we get a child on the phone or a caregiver on the phone that we can really probe about how things are going. I go back to my social work teaching days, and one of the things we often talked about was the importance of open-ended questions. Seems very, very basic to be reiterating that point, but I would encourage us all to think about when we're talking to kids, when we're talking to families, when we're talking to our staff, to make sure that we're asking questions in a way that are going to elicit responses and not just yes or no answers. And so what I liked about this particular piece is it's not only provides us some potential prompts of ways that we can be checking in with parents and care and families, but also just that reminder of, the more that we're able to ask open-ended questions, the more information we're able to actually get about the context of the lives of kids and families. Some concrete tips for actual parents. The American Academy of Pediatrics through their healthychildren.org put out some resources. I mean, we have a resource page on our preventchildabuse.org website where we've cataloged many of these things. But the AAP came out with some recommendations, really key on kind of two areas. The first one is addressing child fears. I mean, when we think about helping to message and support parents, part of it is helping them understand what child fears look like, helping them understand developmentally how fears might manifest themselves and present. If we're talking about little kids, it might be a regression in behavior. As we get to some of the older kids, that might look at increased back talk. And so I think it's helping parents understand what fear responses might look like for kids, so they're setting appropriate expectations. But really, these are just resources for how parents can help think about engaging with their children, as well as some tips around things like positive discipline. So how is it that we can be, setting concrete, understanding that we're all in unprecedented times, but how do you set up routines? How do you set up expectations and be able to maintain and redirect behavior that's not acceptable in your household, and what are some ways that you can go about doing that? Also, the Centers for Disease Control and Prevention, this was pre-COVID, has a pretty robust website where they call it the Essentials for Parenting Toddlers and Preschoolers, where, it really touches on many of the key tips. I've got two daughters, 8 and 5. I know that I personally have visited this website as we've hit different developmental milestones for, how is it that you set structure in the house? How is it that you talk to your kids about different things? So I often encourage folks, as you're thinking whether it's professionally or personally, that this is a great resource. It's got tip sheets, it has videos that really helps thinking about how do we support parents to really negotiate the different developmental milestones of where their children are at. And then a final resource from the Centers for Disease Control and Prevention are the Ready Wrigley series, which again, these were pre-COVID, but really helping families be able to talk to their children in really developmentally appropriate ways about things like emergency preparedness, around preparing for the flu, around natural disasters in general. I think that these are great ways to communicate kind of the reality of what we find ourselves in the midst of COVID right now. But just in closing, I think my final comments would be that, again, I think that this is a time where it's a unique opportunity for us to really be advocating for a prevention system in this country that allows us to identify families early, to provide universal supports and access to families in a voluntary way, recognizing that not all families necessarily need the full span of many of our programs, but oftentimes might just need a light touch program. And the more we can advocate for that, the more we avoid these costly downstream interventions like child welfare. So at that point, I'm going to start coughing, but I'm going to end my comments there.
Thank you so much. It was good timing. You get a drink of water. I loved your presentation. Thank you. I really appreciated the balance of kind of big picture and also really practical. I wanted to share sort of as we transition. So earlier this spring at TexProtects, we really recognized the need to create a go-to resource for parents to use during this time. And so while there's been so much great work and information made available, we also heard sometimes there was almost too much, and that there were so many organizations putting out so much great work that sometimes parents didn't know where to start. And so we really landed on kind of a one-pager with our top 10 strategies for parents. And I think you'll see reflected here some of those. And I think, Bart, you alluded to many of these throughout your presentation, so I'm not going to repeat that information now. But we do have that available as a one-pager electronically, or it can be printed. If that's a helpful resource for those of you on the call today, we'll definitely be sharing that out. In addition, I wanted to include here, Beth, if you can go forward just a bit, a list of kind of our organizational go-to resources for families. And I know many of you have created kind of hubs for families, and we have as well. We call ours the Guide to Thrive, and you can link to that on our website if that's helpful to you. But this is really on the slide now, our short list of resources that we have been finding really useful for families. I think it's been such a challenging time, but also so many great things are happening, I think, in both, for many of us, kind of in provider spaces, kind of expanding our view of our work and recognizing the way so many issues are interrelated, and also the way that because we really are in many ways, not all, in this together, there's been some normalization that has happened about reaching out for help and the resources that do exist. A couple I would point to here, the first two are on our own website, the Family Guide to Thrive. You'll see the Prevent Child Abuse America Hub linked there. Help for Parents, Hope for Kids is through the Prevention and Early Intervention Division at DFPS. 211, of course, is currently our best front door for families to find out what's available in their area. There's crisis counseling hotlines, mental health support line, and then, of course, the Frontline website where you can find out where child care is available in your area. And if you'd like, in the chat box, if you have go-to resources that you've been using in your work, please share those. We'd love to know what you're using with families that has been most impactful. And now we're going to make a little bit of a turn toward recognizing and reporting abuse. So this is critical information anytime, as all adults in Texas have an obligation to report suspected abuse, but especially now with our families under increased stress, with fewer eyes on kids, and those daily face-to-face interactions being replaced with virtual ones, we felt this was an important conversation to have today. As we've discussed, most of the time protecting kids means supporting their families, but as we've mentioned a couple times, we do know that there are children who are in danger within their own homes, and in some cases, the stressors of this pandemic may actually be increasing risks of abuse and neglect. So with that, I'm going to turn it over to Toni Sutton, who's going to share more about what we can watch out for, the impact of COVID on how we might interpret some behaviors that we see, and what to do when we have a concern about child safety.
Yeah, can you hear me now? Thanks, Jennifer. I just wanted to say thank you for letting me be a part of this conversation today. As Jennifer said, my name is Toni Sutton. I am currently serving as the Regional Director for Child Protection Investigations in the Dallas area. You mentioned earlier it was all of North Texas, but can't take credit for all of that. My area is Dallas and then the 8 surrounding counties. And I've been with CPS, and actually my division is now CPI for the last 23 years. So I've had a lot of experience in how these cases come to us and different ways to prevent cases coming to us, actually. So if you are on this webinar, my guess is you are a professional or a person in the community that cares about kids and wants to know what you can do if you are seeing things that concern you. So first of all, one of the first things to do is when you're having contact with children, certain things that you can look for. Bart gave some great resources in ways to reach out to children and expand, your relationship with them. I know FaceTime calls, Facebook connections, all those different things that we're doing in this time of COVID that's very different than how we normally get calls. One of the things that we have seen with CPS in the time of COVID is that we have had a serious decline in intakes. And unfortunately, what we know is COVID didn't stop abuse and neglect from occurring. It just stopped, unfortunately, some of those normal channels for getting the referrals, the teachers and the counselors and the professionals that are having ongoing contact with children and that normally make the referrals to us. Unfortunately, we're just not seeing that same volume. So when you do have opportunity to interact with children in the community or through your service provider, go ahead and look for things that they're going to say to you, either through those calls, through the video, or in writing. Some of them do come out right and say that they've been physically harmed or sexually abused or that they've been touched inappropriately. Those are certainly things that you're going to look for. They sometimes will disclose that someone in the home is being abused or at risk of physical violence. And a lot of times with that, what we're looking for is the domestic violence component. If, mom or dad is being harmed by their partner or things are going on in the home that make them worried or scared, or if they're worried for a sibling. If kids are disclosing to you that they're frightened of any adult in the home, that is certainly something that we would be involved in and looking into. For our children as well, if they are experiencing any suicidal thoughts or any suicidal ideation, any thoughts of self-harm at all, that's certainly something that we would look into and help provide some resources and support for. If you're hearing or seeing as you've made calls or been in contact with children that they are, a younger child and that they're being left home alone for long periods of time, that's something that we would look for. As Jennifer said at the onset, a good majority of our calls are about neglectful supervision, not necessarily about abuse, but children being left in situations that could be potentially harmful to them or exceed their capacity to take care of themselves at that stage. Any child that talks about sex or knowledge of sexual acts that are far beyond their normal developmental age, that's something that would warrant a call or report to CPS as well. Beth, can you do the next slide? So other things that you might see while you're on the video calls that would be cause for worry or concern is an unexplained bruise or mark on a child. Sometimes they'll show up with, marks to the face or across the torso, that type of thing. Anything that doesn't necessarily align with the explanation given for how they received that injury. If you're on a call or video chat and you see a parent or caregiver using extremely harsh or physical discipline that causes you concern, that would certainly warrant a call or getting online and reporting to CPS. We've also had reports of caregivers leaving dangerous objects within the screen view for kids. So an unsecured gun, any drug paraphernalia, anything like that, that would cause you concern about a child having access to that. Also, you might see a significant change in the child's mood or behavior. If this is a child that you have worked with for a long time, or a niece or nephew that you have contact with, and you start to see major changes in their mood that you can't attribute to just the change in the circumstances, not seeing their friends as often, being under shelter-in-place orders, that type of thing. That's something that we often see reported, major changes in their mood or disposition. And again, under the physical neglect realm, anytime a child discloses that they haven't eaten today or have had no access to water to take care of physical hygiene, that's something that we would look into as well. And again, as Bart and Jennifer had prefaced it, we're living in unusual times, and it may be just an unusual circumstance or different things that they're dealing with as far as the family being stressed due to COVID. It doesn't necessarily mean it's abuse or neglect. It just means that it is causing you enough worry to make the call. Beth, can you get the next slide? And again, it's important to be aware that families are facing huge challenges that may not be signs of abuse or neglect, but the great news is, as a reporter, you don't have to figure that out. If you are having concerns or worries about a child, all you have to do is make that report. We will certainly look into that, and it's CPS and the Department of Family Protective Services job to make the determination of whether or not that is actually abuse or neglect. So some of the other things that you may see is that the child might be frequently absent from class due to the technology or internet access. Again, what we've found is a lot of our families in the community don't necessarily have constant access to Wi-Fi or electronics or those type of things. So an absence doesn't necessarily mean that they're being abused or neglected. A child may not complete assignments because the caregiver does not speak English and can't help them. Apologies to my daughter's 5th grade teacher for her lack of learning that has occurred. None of us were prepared to be full-time teachers in this time of COVID, so certainly that could be attributable to the COVID and not an abuse or neglect situation. A child may act disruptive or withdrawn because a family member is ill, so certainly if they're experiencing stress and worry about a loved one, that's going to show up in their behavior as well. And then, of course, a child might be dirty or disorganized because a caregiver is juggling work and other child care obligations. Kids not showering for a few days is not that big of a deal as long as they do have access to water eventually. Beth, can you do the next slide? So after all those considerations, if you are still having concern and worry about a child, we definitely want to urge you to go ahead and make that call. And there's a number of different ways to do it. There is the 800 number that is on the screen, or you can go online and type it in yourself and just do that at any time. Both options are 24/7. If you do make the call with DFPS at the 5400 number, you'll be connected with a statewide intake worker, and that person can actually help walk you through and ask you specific questions to help determine, if in fact your worries do meet the level of abuse and neglect, and if it's something that needs to be reported. As you know, all adults in Texas are mandated reporters, and if you have those suspicions of abuse or neglect or those worries, you're mandated to do that to make that report within 48 hours. This next one, it gets a little bit controversial. It says DFPS keeps the name of the reporter confidential, and we certainly do. The reporter's name is not disclosed to the family. However, especially in the time of COVID, when kids are a little bit more isolated, it's not unheard of for parents or caregivers to figure out who the reporter is through process of elimination. But I would definitely encourage you to not let that dissuade you. If you are worried about a child, you definitely need to call and talk to somebody about that worry. One of the other things that I wanted to touch on is to just remind you all that fewer than 10% of the investigations that CPI investigates and looks into actually result in a removal of a child. And I know just for my own friends and family members who have been worried about children, everybody's hesitant to report because they don't want to make things worse and they don't want to see that child end up in foster care. That's definitely not the first line of intervention that CPS uses. If we come in and determine that abuse and neglect is occurring, we're going to look at some other options first. If it can be mitigated through service referral, getting the family hooked up with referrals within the community that can help keep that child safe. We always want to try to keep the child within their own family as a first line of defense. If we are unable to do that, to keep the child with their family and still ensure their safety, then the next thing that we would look at is a parental child safety placement. And what that is the option for the parent to place the child with a friend or family member who they know and trust that would take care of the child while they handle whatever is going on in their own home that cause them to not be able to keep the child safe within their own care. After that, we have family-based safety services. Again, once the case has been investigated and we determine that there are issues that need to be addressed, that's a service referral and a caseworker that gets assigned to the family to help provide ongoing services to help keep that child safe. The other thing that's really exciting with the state of Texas is about 3 years ago, we introduced an additional track for cases to go down, and it's called the Alternative Response Track. So when you make that call to the statewide intake or you report online, what happens after that intake comes into our system is it goes to a screener, and that screener will look at the facts of the case that you've reported to determine how high the risk is and figure out if it needs to go to a traditional investigations track or if it would go better for alternative response track. And alternative response is exciting in that it is truly an outreach program for families, and that the caseworker is assigned to the family for 60 days. There's not a disposition of reason to believe ruled out at the end of that case. And it's very much a collaborative operation with the family, in that the family gets to decide with the caseworker what's working well for their family, what are they worried about, and what needs to happen next. And they are truly engaged with the family and providing resources. And they are the experts in the community for getting families hooked up with whatever they need to help keep their children safe and to make their family better after their involvement with DFPS. So that could be, public housing, that could be food bank or food pantries, whatever it is to help them better their situation and to keep their own child safe within their family. What else? So that kind of covers the alternative response. Yes, but I'm very excited about alternative response because it's just truly a unique pathway for CPS. And again, it mitigates the risk that the reporter was seeing with the family, but also ensuring that the family gets to stay safe and intact. So exciting times for us. CPS in the time of COVID, one of the things that you should know is that CPS staff are considered essential employees, essential staff. So they have been out there every day in the midst of this COVID pandemic, knocking on doors, making contact, interviewing children. We've gotten very creative about doing that and trying to also be very respectful of the families that we're visiting with. So they are wearing masks, face shields. We're using technology to do FaceTime interviews, but every day, there are boots on the ground checking on children and making sure that families are safe. And Beth, I think that's my last slide.
Thank you, Toni, if y'all can hear me. And a few questions came through while you were talking, so we're going to go back to those in just a moment. I wanted to point to the resources that are on the screen now. So akin to the parenting strategies document that I referenced earlier. These are some resources that we developed during COVID in response to kind of calls from the field and things people felt like they needed. And so these are available on our website, and we'll also be sending them out as part of the follow-up from this call. But there's a one-pager on a lot of the content that Toni talked through just a moment ago. We also have these available as a kind of a flyer, front and back, with the parenting tips on one side and how to recognize and report abuse on the other. And if that's something that you would like to have in hand to share with families as part of your work, you can email us and let us know. We have some of those available for distribution, and we'd be glad to send them your way. So before, I'm going to open it up a bit for Q&A with the time we have left. And so if a question came up for you along the way that you haven't already put into the chat box, please feel free to do so. And I'm going to go ahead and tackle the two that I saw come through as Toni was talking. So Toni, if you don't mind being kind of on call here for a moment, I'm going to sort of send these your direction. So one question that came up while you were talking was around suicidal ideation and sort of the muddiness there perhaps in when that would maybe warrant a call to the abuse hotline versus a mental health support line. So do you have anything else you might say about that?
So what I would offer is they don't have to be exclusive. If you have a child that you are worried about right that moment, you can call the hotline. You can call 911 if you're worried that they're going to do something immediately. One of the things I didn't touch on was just the way our cases are qualified, in that it's either going to come in as a priority 1 investigation, which means a caseworker will get out their stat, but within 24 hours, or a priority 2, which means they have 72 hours. But if you're telling me that you're worried about a child actively engaged in self-harm, that's going to come through as a priority one. That gets reported to us and law enforcement at the same time. So if we need to partner with them to gain access to the child, whatever needs to happen to make sure that they're safe and don't follow through with that plan.
Thank you. That's really helpful. And I hope in general, I appreciate how this conversation kind of really does give us kind of different tools in our toolkit. And so while, you know, we've talked about resources that we can use for families that might be part of our own work, where we can connect when that question or need sort of falls outside of our normal scope of work. And then when we need to make a call, and recognizing that when we make that call, we're not needing to decide what the next steps are, that's really the job of the person on the other end of the line, and that there is sort of collaboration and engagement of multiple parties on the other side of that call. The other question that came through for you, Toni, was around neglect. So the question was just really, what is considered neglect?
And that one is pretty broad because it also depends on the age of the child. But if you're talking about a child 5 and under, just access to basic needs as far as food, water for an infant, formula, breast milk, whatever that looks like. It's just such a very broad question. So we categorize neglect as a child being, placed in a situation beyond their developmental capacity. So clearly an infant's not going to be able to get their own, food, clothing, that type of thing. Older children, it's a little bit different situation. Also, if you've got a parent that's under the influence of drugs, a lot of times that will get categorized as neglectful supervision, because if I have a caregiver who's incapacitated due to drug use, they're not going to be able to provide the appropriate supervision for that child. I don't know if I actually answered the question, because that one is just so broad for us, because it covers pretty much anything. It's basically a child not getting what they need to thrive.
Thank you, Toni. I know that was a big question, and I was going to just kind of point to the definition, which also is quite broad, right? So I think the nudge I would give is that, again, you don't have to make that decision if it's reaching a level of concern for you where you feel like an easy handoff to a community resource isn't really going to get at an answer, then the folks on the other side of the call will be able to make that assessment. It doesn't have to be on the caller to do so.
Absolutely.
Okay, I'm just, let's see. I'm just skimming through because we have our poll questions in here too, to make sure I didn't miss a question. Can you talk a little bit, Toni, about when you do get a call and it's not abuse and neglect, what happens for those families?
Certainly. So,
or what could happen?
Yeah, so certainly if you make the call or you make the report online and it doesn't meet our criteria, then that's not something that we would actually go out and investigate. So what happens with the case when it comes through to statewide intake, as I mentioned before, the first thing it does is go to our screeners. And what happens with the screeners is, more often than not, they will pick up the phone and they'll call the reporter who made the report to try to get more information, to see if it's something that we do need to become involved in, or if there's other resources that we can give the family. For instance, if it's an out-of-home perpetrator that lives out of state that doesn't have routine contact with the family, that's not necessarily something that we would investigate, but that would be something that would be referred to law enforcement.
Thank you. And I think that's all the questions I see so far. I want to do a few other kind of housekeeping tasks as we finish our time together. Thank you, Bart and Toni, so much for all of this information. I think it really does sort of help build out our toolkit as all of us sort of are encountering families with needs that are quite diverse, maybe more severe, and maybe outside of our normal wheelhouse, right? So we're all having to grow a little bit during this time and figuring out how to meet needs and ensure child safety. Some of the things you've just mentioned, Toni, sort of made me want to give a nudge to our next series of Zoom Lunch and Learns, which are going to happen on July 21st and July 23rd. So on the 21st, we're going to roll out a set of tools in the form of flowcharts that will help you understand the CPS system and really look at the way a case moves through the system. And so some of the things Toni's been talking about in terms of what happens when a call comes in, or what happens if it's referred to family-based safety services or alternative response, will be covered in a lot of depth in that webinar on July 21st. And then we're going to follow that one on the 23rd with a conversation about a new vision for child welfare, which may point a little bit to some of the conversation that Bart opened up at the beginning about how we think more comprehensively about how we really create a system for prevention rather than just intervention once there's been a crisis, and sort of looking at the needs of the whole family and the whole community and building that prevention system. So save the date for those. We'll send out more information. Thank you all for joining us today. We will be sharing out the slides as well as some of the resources that were mentioned as part of the follow-up, and they will, the recording of this webinar will also be posted on our website if you want to access it later. I think our contact information is up for you now. Feel free to reach out with questions, and we hope to see you again on July 21st. Toni and Bart, thank you again, and I hope you all have a fabulous rest of your Monday and rest of your week. Be well.